Hello and welcome to Vivian Augustine's Health Hub. In this video, we are walking through pregnancy weeks 33 to 36, the final stretch before full term. These weeks are all about rapid growth, preparation for birth, and the noticeable changes in your body. Let's break it down week by week so that you will know what's happening with your baby and the changes you might be feeling. Let's look at week 33. At 33 weeks, your baby is about the size of a pineapple and weighs around 4 to 5 pounds. And the major development at this time is the continuing growth of the brain. Your baby's brain is forming more connections, and the skull remains soft and flexible to allow for easier passage through the birth canal. Their bones are hardening, except for the skull, and their immune system is developing, getting ready to function outside the womb. You may notice stronger and more frequent movements. Kicks, rolls, and stretches can feel quite intense now because there's less room in your uterus. Some of the common symptoms at weeks 33 is shortness of breath as your uterus pushes against the diaphragm, heartburn and indigestion, difficulty in sleeping, and also you may see swelling of the ankles and feet. By week 34, the baby weighs about 5 pounds and it continues to gain fat, which helps to regulate body temperature after birth. The lungs are maturing and your baby is practicing breathing movements. The skin is becoming smoother as fat fills it out, and the baby's body is looking more like a newborn. At this stage, many babies began moving in a head-down position in preparation for delivery. At week 34, you might experience increased fatigue, Braxton Hicks contraction, pelvic pressure, and frequent urination. At 35 weeks, the baby is around 5.5 pounds and continues to gain weight rapidly, about half pound per week. The kidneys are fully developed and the liver is functioning. Your baby's hearing is fully developed, so they can recognize your voice and even respond to familiar sounds. Space in the uterus is now very limited, so movement may feel different. More rolls and stretches rather than sharp rolls and stretches, rather than sharp kicks. Your body may show back pain due to extra weight and posture changing. You may have trouble sleeping, stronger Braxton Hicks contraction, and the increase in vaginal discharge. Welcome to week 36. The baby is now considered late preterm and almost full term. They weigh about 6 pounds or more, and they continues building fat store. Most babies are now fully in the head-down position. The digestive system is ready, and the lungs are nearly fully mature. Your baby's body is essentially ready for birth, with just a bit more growing and strengthening to do. Symptoms you may notice: increased pelvic pressure as the baby drops lower. This is called lightening. Easier breathing but more pressure on your bladder. More frequent urination. Possible signs of early labor like regular contractions or lower back cramps. During this time, it's important you monitor your baby's movement daily. You attend all your prenatal appointments. Watch out for signs of preterm labor such as regular contractions, fluid leakages or bleeding. Prepare your hospital bags and the birth plan. Weeks 33 to 36 are an exciting and sometimes a challenging period as your baby and your body prepares for delivery. While discomfort may increase, remember that each symptom is a sign that your body is doing a great work. You are getting very close to meeting your baby. Just a few more weeks to go. If you found this helpful, stay tuned for the next stage where we will cover week 37 to birth, the final countdown.